Hello, my name is Nick Allen, and I did both residency and fellowship training here. Residency, of course, in the adult psychiatric program, and fellowship in the consult liaison program. Um, what brought me to Mayo? Uh, you hear everyone talking about that feeling on the interview day, which is, of course, complicated now with COVID, but I got that feeling on the interview day. And I think it was a combination of things that gave me the feeling. And the primary one was that I clicked with the people here. Um, there was an interpersonal warmth that really attracted me, and it was clear that everyone's primary objective was to carry out their passion for clinical care, but also for teaching. And that was really exciting for me. There was also, it was clear that not only would I be challenged here clinically, but also nurtured in a way that would maximize or optimize my personal growth potential. And that was also very exciting for me. And in the retrospectoscope, I think I was right about that. I do think that I grew as a clinician to the most optimal extent possible here. But I also think that I grew as a person to a degree here that I might not have elsewhere. And I think that, again, gets back to the balance of challenge and nurturance that happens here. What keeps me at Mayo are many of the same things that brought me here, which the interpersonal warmth, passion for clinical care and teaching, the balance between a challenge and nurturance to optimize my growth potential. But what that's specifically become at this point in my career is mentorship. And that I can pass on my own passion for clinical care and for teaching here, so that not only my patients, but also my learners can optimize their growth potential. What was my favorite thing about Mayo? The weather. Just kidding. The people, but also the resources. There's countless resources to help take care of your patients here. So I feel like I can take care of my patients best here. Best memory of residency, butting heads with my program director. I was on One West, and we had a difference in philosophy when it came to approaching a certain difficult patient. She thought that I was being too supportive and should do more challenging, and I thought that she was being too challenging and should be more supportive. Turns out that particular philosophical difference has quite a history in psychodynamic thinking. And the reason it's my favorite memory is because that was a difference in thinking that could have gone very, very wrong, right? Don't get me wrong, it was incredibly uncomfortable at the time, but it has led to one of the strongest mentorship relationships that I've ever had at any point in my educational life. So Dr. Swintak is now not only a mentor, but a very close friend. And when it comes to fellowship, there was a really neat thing that happened, and I couldn't tell you exactly what point it happened, but at some point, my consultants, my supervisors, stopped looking at me and treating me like a trainee and started treating me like a colleague. It probably happened somewhere in the middle to the latter half of my fellowship year, but I felt a subtle difference in approach that, they were satisfied with my grasp of knowledge and clinical skills. They trusted me and my judgment, and we bounced ideas off of each other instead of sort of a transfer of ideas from the supervisor to the trainee. And that was really neat for me, that I felt a part of I felt a part of, well, a lot of things, but a part of a group that I had looked up to for a very, very long time, and that I had earned their respect. The other thing that's really neat about doing residency and fellowship here is the opportunity to explore so many different clinical specialties that are really at the forefront of a lot of research, but also that Mayo prides itself on being strong in all three shields, as they put it, of the patient care shield, the clinical practice shield, as well as the educational and research shield. Yeah, over here, that's what that is. And as you can see there, the patient care shield is front and center, but it is supported equally by the research and education shields. And I think that's borne out here. I really do. I can't say that I've mastered all three, but the opportunities to reach your educational and research aspirations here are present, and the number of resources available for each of those continues to surprise me. So why do I teach? I teach because it challenges me to continue learning, and it also brings me joy. I approach educating in a similar way that I approach a patient, which is to try to figure out what their previous experiences were, what their goals are, and then to try to teach, but also in a bidirectional way, where they're participating in the education, and I'm learning from them in a way that focuses on specific tools and skills that are going to get them from where they were experientially to where they want to be aspirationally. One of the main things that I'm passionate about is clinical training. Another thing that I'm passionate about is physician well-being, and a couple of other niche interests, you could say, I suppose, is the medical psychiatric spectrum, as well as systems of care, and trying to optimize the patient experience across the system of care, aimed at the most optimal outcome possible. It's obvious, or at least it is to me, that the patient needs come first. And even though there's a wide variety of clinical experience and skills that span the multidisciplinary team, from the medical student to the resident to a senior resident or fellow, and a supervising consultant. Some other places call that attending, as well as social workers and recreational therapists and pharmacists and nursing, and all the other parts of the clinical team that come together. Everyone has an equal footing on that team. Everyone has something to contribute. And there's a lot of cross-disciplinary talk about what is the best thing for the patient. And I think that not only keeps us humble in terms of everybody on the multidisciplinary team, but also keeps us learning, and in a way that is conducive to the best possible care for the patient. And I think that is quite unique and special about Mayo. Rochester has 6 months of excellent weather and 12 months year-round excellent clinical training. I kind of summarize it for people that the weather at Mayo is cold, but people's hearts are warm, and I think that's true. But what I like to do in my free time in those 6 months of really excellent weather, there's a lot of really good hiking, biking, and fishing around the Rochester, Minnesota area. Happy to answer more questions about that. I recently just discovered the trout fishing in southeastern Minnesota. And my goal this year is it's kind of a goal every year, is to try to figure out how you're going to stay active in those 6 months of winter. It's not 6 months, but 6 months of colder weather. And my goal this year is ice fishing. So stay tuned. We'll see how that goes.